Hi Kinds, welcome back to our channel Be Kind. So those of you who are new to the channel, this is me Kriti and that's my husband Shrey. We moved to Canada in Jan of 2023 and we live in Toronto, Ontario. You must have seen from our previous videos that we visited India to meet our family, and in the last video you must have seen that we tried Tim Hortons at 3 different locations. So if you have not seen that video, we will link it down below. In the same video you must have seen Shrey's little sister Dr Pihu and her friend Dr Pragyan trying Tim Horton with both of us.
In this video we will be talking about them and their decision to move outside of India to pursue higher studies. Both of them are moving to another country. Is it Canada? Is it US? Is it UK? Find that in this video, and if you are an aspiring doctor, these conversations will be really helpful for you as you plan your future. In this video we also talk to them why so many doctors are leaving India and what made them take this decision, and how is the work-life balance and pay structure comparatively for younger doctors in India versus outside. So let's start the video, and if you haven't subscribed to our channel, please subscribe it. It will be a big boost to us and our channel and our efforts to bring quality videos to you. Okay, so I am sitting with Dr. Pihu and she's my little sister, so I'm proud of interviewing her. Can I call you Pihu and not doctor?
Yeah.
Yeah, okay. So Pihu, you have done your MBBS from a government college. How is it different than doing it from, say, any of the private colleges?
So one of the main differences is fees. So the fees in a government college is minimal. My fees was around 12,000 for a year, whereas in private colleges it can run up to 1 to 2 lakhs per year. So that is one difference.
And I think that's the lowest, right? Some of the private colleges, the fees are in multiples of lakhs per year.
And even for entering into the private college, there's a fees.
Yeah.
So that can also run into high numbers.
And the job opportunities after it, are they similar from a government college and a private college, or they are also different?
So studying either from a private college or a government college does not matter a lot.
Okay.
It only depends on the individual and how much hard work they can do. So the opportunities are the same. It may be possible that the exposure they got in a government hospital was little more than the exposure they got in private. Still, it depends on the individual, because they can always opt to do an observership or do a job in a government sector and gain that exposure afterwards.
Okay.
So Dr. Pratik, you did your MBBS from Bangalore Medical College. So how has been your experience doing MBBS in a government college in India?
I would say it was pretty good doing it from a BMC. It was one of the prestigious colleges in the whole nation, and I feel proud that I am a graduate from BMC.
So post MBBS, what are some of the options in India that the students can explore?
Post MBBS, they can choose either to continue going in the field of medicine, or you can leave medicine and do some paramedical work, like can help as a civil servant, or you can also go into corporate sector, like in pharmaceutical companies and in some other research institutes. Most of the people went for pursuing post-graduation in various departments.
And you have worked after doing your MBBS in India, right? So from a career growth perspective or salary perspective, what is the growth sector in India for doctors?
Okay, so after your MBBS and before pursuing post-graduation, you can work as a junior doctor, that is as a junior resident in government hospitals, or as a medical officer in private hospitals in the whole country. So I have worked for a few months in a private sector, and the salary, if you would ask, it is around 50 to 60k depending on the states. Okay, like in Delhi it is around 50k, 50 to 60k. In Haryana it is little lower side.
And how flexible are your work hours? Do you have night shifts often, or the work hours are reasonable?
Again, it depends on the department you have chosen up to work in. As per me, I worked in a clinical department, and my hours were quite social, I would say. It didn't involve any night duties, no duties on weekends. I was pretty lucky for that. But people who work in the wards, they have to take up night jobs, weekend jobs, and they will have to work for 208 or 216 hours per month. As compared to me, who would work around 180 to 200 hours per month.
So now that you have studied and you have worked here for a little bit, why are you choosing to go abroad to pursue your post medical studies? Why not India for that?
Okay, this is a question which I get asked most often, and I would just say I weighed out my pros and cons. So while there are many pros in continuing in India, but the most important thing which bothered me was the work-life balance in India and the pay.
Okay.
The pay scale is really sad in India
Okay.
as compared to the Western countries. In
Okay.
India, there is no cap on the number of hours you work per week. There is no cap.
Okay.
Legally, there might be a cap, but no one follows it. So they can ask you to work for any number of hours in the nights as well, in the weekends, and you cannot even complain to anyone.
Okay.
So I would say, like in people in first year residency, second year residency, they never have time to go out of their hospital campus.
Okay.
It's that bad.
Okay.
But while in Western countries like in UK, work-life balance is pretty good.
Okay.
The number of hours, it is capped. It is 40 hours per week, but your rota can involve working up to 50 to 55 hours per week, which is quite okay-ish, I would say. As compared to the pay as well, it is
Okay.
better over there.
So once you finished your MBBS, you did your internship, and simultaneously you started thinking of going outside India to
Yeah.
pursue your higher studies.
Yes.
So what are some of the countries that came into this consideration set?
So if you have to go abroad, the earliest preparation starts from third year of medical college.
Okay.
And why? Because we start, if students are planning to go to the US, third year is the right time to start, because that's when they start giving their entrance exams.
Okay.
For UK, you can start as late as your internship.
Okay.
So from my batch, people have gone either to the US or to the UK.
Okay.
But if now that I've gone and experienced the culture in UK as well, from UK people also go to Australia.
And what was the reason for you to choose UK over US?
So I had given my US exams as well. However, once I got to know more about UK and how it's comparatively easier for someone who has no connections in the outside world to get into training in the UK, so that is one point which was favorable for me to go towards UK than US.
Okay. What is the process to go to UK? Like if you have to pursue your, say you have done your MBBS, now to do your MD, what is the process, if you can give a broad understanding?
Yes. So I can tell you about UK as well as the US,
Okay.
because there are many people who plan to go to US as well. So for US, as I told you, it starts with the US-MLE exam, which earlier there were 3 exams, but now there are only 2, step 1 and step 2. So you start your step 1 in the third year of medical college, and then once you pass that in internship or after that, you can cover the next steps. And once you're done with that, you have to do observerships in the US, but you have to pay for that and you will not get any salary in return. So for 6 months you have to gain experience in the US, spend some money, and maybe people have been there for 1 year or more than that just to get a good resume so that they can match into residency.
Okay. So just to recap, you have to give 2 exams
Yes.
and do a 6-month observership in the US.
It's
where-
not compulsory, but people prefer to do it because it will highly increase their chances of matching. Because
Okay.
if you don't match, then it will be on your resume that you have not matched in the first year. So it's a red flag.
Okay, and you have to pay a salary for observership. You have to
Yes.
pay a fees and you don't get a salary.
Yes.
And after that, you will be matched with a college where you will do your MD or
Yeah.
MS.
Yeah.
And how long is that?
So it
In
depends. It is of 3 to 5 years. Surgery can extend up to 8 years as well. So
Okay.
it really depends on the specialty.
So that is US.
Yes.
And in those 3 to 5 or 8 years, are you getting a salary?
Yes.
Okay.
Yeah, we are getting paid and it's a pretty good salary.
Okay. Now coming to UK, what is the process to go to UK for
Yeah.
a doctor who has done their MBBS?
So if somebody is planning to go to the UK, then the first step has to be after the 4th year of medical college. They cannot start before that. But what they can do is they can keep building their resume
Okay.
by doing research, audit, everything else. So once you're in the internship, you can give the first exam, which is PLAB 1. It is a written exam and there are many centers across India to give that exam. Whereas the second exam, which is PLAB 2, it will happen only in Manchester, United Kingdom. You have to go there. It is an OSCE or a clinical based exam, and once you clear that, it's a pass or fail exam, and once you clear that, then you're good to go.
Okay.
But before that, you also have to give English proficiency exam. So I gave IELTS exam, and after that only I could give my PLAB 1.
Okay. So IELTS, PLAB 1, PLAB 2 to do 1 year of observership or job in UK for which you are going, and after that you will do your further studies, right?
Yes.
How long is the studies?
So in India the internship is of 1 year, whereas in their curriculum in UK the internship is of 2 years.
Okay.
So I have done 1 year of that internship in India, and the remaining 1 year I have to do in the UK.
Okay.
So that is known as foundation year 2, which I will be doing there.
Okay. And then how long is the MD period?
So the MD training, MD or MS training in the UK is clubbed. So you have to do specialization as well as super specialization together.
Okay.
So the specialization is of 3 years and super specialization is for further 4 years.
Okay.
So for MD course, it's a 7-year course.
Okay. And can you give an idea of what the salary would be for somebody who is, say, in their first year of MD program in the UK, and what the salary would be if they were doing it in India?
Yes, so the major difference between UK and India is once you enter into training, or even the foundation year 2 internship that I was telling you about, you don't have to pay any fees.
Okay.
Okay, so you are only paid your salary, and it can even increase if you are doing out of hours and all of that. Whereas in India, when you are doing your post graduation, you have to pay a fees.
Okay.
So recently my friend has matched into a postgraduate college, and his fees is 1.4 lakh for a year, and his stipend is 70,000
Per month.
Yes.
What about in UK? What would be the salary?
So in UK it's roughly around 33,000 per annum GBP. So that comes out to be around 2 to 3 lakhs INR per month.
Per month.
Yes.
Okay. So
Compared
that's a
to
good
60,
salary.
70,000 INR per
Okay.
month here.
And of course, the work-life balance in UK would be better than in India. Is that right?
What I have heard is that in the UK life is also very hectic, and there are unsociable hours there as well, but they are paid for that. So if you're
Okay.
doing night shifts or weekend shifts, or if you're working on a bank holiday, you get a compensatory holiday next day, or you can take it whenever.
Okay.
So the salary or the stipend increases if you're doing unsociable hours, whereas in India there's no fixed time, there are no fixed hours for a resident, and it's their job to get everything done.
Okay.
There's no such concept of handing it over to the next team.
Okay. As a doctor, you have spent some time in the UK and also in India. Have you seen a difference in the attitude of patients towards doctors there or here, or it's the same, the level of respect?
Okay. So the level of respect in both places is the same. I have personally gained a lot of respect from patients everywhere. The only difference is how we treat the patients. So over there, we like to educate the patients about everything. Before we even start a treatment, a medication, we inform them that this is what you're doing, are you willing to go ahead with it? Whereas in India, I don't think it's a very common phenomena to ask their permission to start any treatment. We say that we feel that this is the right treatment and you should go ahead with it, and the patient agrees.
Okay.
Whereas in UK, it's not that common.
So my last question would be, any tips that you want to give to students who are still deciding whether to go out of India or to stay here? How did you choose or make that decision? Can you guide them?
Yeah, I was in a major dilemma till internship. As you know, I was studying very rigorously for Indian entrance exams. But what suddenly changed was during internship, when it became so hectic for me to study for the entrance exams as well as do my duties properly, which actually needed dedication. So that's when I decided that I really need to slow down and relax and take work-life balance little more seriously. And that's when you were also planning to move to Canada, and seeing that life made me decide that I know that it may take 1 or 2 years extra before I start my training compared to my peers here, but that one step is just a matter of courage. You have to take that step, and if you want to go abroad, then you have to take that step, and you need to muster that courage to go abroad.
Yeah,
that's
that
all
is
it
true.
takes.
Even for moving to Canada as PRs.
Yeah.
Like, people leave their careers when they move there. A lot of people have to take 1 or 2 steps back.
Yes.
And then start that journey again. But over a period of time, that 1 or 2 years gap does
It
not
doesn't
make
matter.
a big difference, and you end up achieving a better quality of life.
Yeah, any tips that you have for aspiring students who want to pursue their studies, especially medicine, outside of India? What can they start with? What are some of the options they have in the Western countries, if you are aware of that?
Definitely. The most important thing I would say is, if you are looking to practice abroad, work towards that field right from the first year of MBBS. Like start doing research, start doing audits. Most importantly, if you have chosen a subject in which you are interested in, be loyal to that field. Like if you want to go into surgery, be loyal to your field and do research, audits, some social work into that field. And it's definitely not very difficult to go abroad. It's same as in India, but it does make a difference in your life if you are interested in that.
Okay, thank you, Dr. Pratik,
Thank
for
you.
being on our channel and sharing such great insights.
Sure, my pleasure.
So thank you so much for answering,
Thank you.
and all the best for UK.
Thank you.
So you must have seen why Dr. Pihu and Dr. Pragyan decided to move to UK to pursue higher education or even look for better job opportunities in the field of medicine.
So if this video was helpful for you, please share it among your friends. Comment down below if you have any questions for both of them, and please subscribe to the channel. It would mean a lot to us. We'll see you again very soon. Take care. Bye-bye.
Thank you. Bye-bye.